Hello, Tiara Means here. Welcome to tonight's episode of For the People. Tonight we will be focusing on the topic of food deserts. We are delighted to also have Sarah Walters, who lives in Louisville, Kentucky, in an area classified as a food desert. Obesity has become an epidemic where millions of Americans are morbidly obese. People have many excuses for not eating healthy. One reason is that some people live in area classified as food deserts. Well, Mrs. Walters, could you explain to the audience what a food desert is?
Yes, according to the CDC, a food desert is area that lacks access to affordable fruits, vegetables, whole grains, low-fat milk, and other foods that make up the full range of a healthy diet.
The U.S. Department of Agriculture's 2009 Food Desert Study examined access to supermarkets and determined that 23.5 million people cannot access a supermarket within 1 mile of their home. I have learned that these areas are normally full of fast food restaurants and convenience stores with few healthy options. Without access to healthy foods, a nutritious diet and good health are out of reach. Research has shown that food deserts do exist in many low-income communities. In Albany, New York, 80% of non-white residents cannot find low-fat milk or high-fiber bread in their neighborhoods. And in Baltimore, 46% of lower-income neighborhoods have limited access to healthy food, based on a healthy food availability survey, compared to 13% of higher-income neighborhoods. Many people in these areas lack transportation to get to grocery stores and rely on the convenience stores located in the area. It has also been proven that people who live in food deserts are more susceptible to diet-related chronic diseases. Our multi-state study found that people with access to only supermarkets or to supermarkets and grocery stores have the lowest rates of obesity and overweight, and those without access to supermarkets have the highest rates. Mrs. Walters, can you describe the area where you live?
The area where I live could be classified as a low income. There are a couple fast food restaurants within walking distance. There are plenty of convenience stores though. Unfortunately, I don't have a car and the nearest supermarket is 8 miles away. Some of the convenience stores carry meat and other grocery items, but they are not the best quality and the price is very expensive.
How unfortunate. Can you tell the audience how living in your neighborhood has affected your health?
I have high blood pressure and I was just diagnosed with diabetes. My doctor advises me to eat healthier foods, but many times I can only buy food I can afford. I am on a fixed income, so the food I buy is usually not that healthy. I have to pay for transportation to the nearest grocery store and many times I can't afford to do that.
Mrs. Walters, some people feel that even if grocery stores were put in areas classified as food deserts, that people will still not make healthy choices. Do you agree with that statement?
No, I don't. The people I personally know in my neighborhood constantly complain about the low access to healthier food. Some of us have even started to try and grow vegetables and fruit in our backyard.
Studies find that residents with greater access to supermarkets or a greater abundance of healthy foods in neighborhood food stores consume more fresh produce and other healthful items. A survey of produce availability in New Orleans small neighborhood stores found that for each additional meter of shelf space devoted to fresh vegetables, residents eat an additional 0.35 servings per day. It was also shown that for every additional supermarket in a census tract, produce consumption increases 32% for African Americans and 11% for whites, according to a multi-state study. Mrs. Walters, are you aware of any current policies that are targeted towards food deserts?
I have heard about the Pennsylvania Fresh Food Initiative.
Yes. The Pennsylvania Fresh Food Financing Initiative (FIRE) is an innovative program that increases the number of supermarkets and grocery stores in underserved communities